Urethra. Good morning everyone, and today I'll be discussing on the management of stricture urethra. So stricture is nothing but a block which is there in the passage of urine. So this is your bladder, the control mechanism, and this is your urine passage which comes inside the penis. And then if there is a chance of developing a block there, you start getting symptoms such as difficulty in passing urine, you have to strain, you start getting a sensation you're keeping a lot of urine inside. There are recurrent urinary tract infections, and all these are symptoms of stricture. There are many causes of having a stricture. One of the commonest causes is after instrumentation, having a urology surgery, or having a catheter for appendix surgery, as simple as that, because the catheter can cause a stricture. It doesn't happen in everyone, it happens in about 2 out of 100 men, but this happens. Occasionally there are black or white lesions on the tip of the penis or the glands, which is a skin disease called as lichen sclerosis. So lichen sclerosis can have a stricture in the urinary passage. Having unprotected multiple sexual partners can lead to sexually transmitted disease. Injury, road traffic accident, these are the commonest causes of stricture. Sometimes we don't know the cause and then we call it an idiopathic, where there is no known cause for having a stricture. Normally, there are many ways of treating a stricture, but the best way is still a urethroplasty, which is a gold standard. If you have a short stricture, you can have an endoscopic cut, which is recommended by urologists, but if there's a long stricture, you need a urethroplasty. Now, when you make a cut, that is called as DVIU. All the men with stricture have been through that. But what's important to know is scientifically from the paper, especially which comes from Dr. Richard Scientific Units in America, the success rate of first DVIU is 9%, second DVIU is 3%, and any DVIU after that is 0%. So there is no role of having multiple DVIUs. Another important factor is sometimes the treating physician tells you after doing a DVIU, you have to pass a tube inside the urethra and do a dilatation, which is called as self-catheterization. But every time you do a self-cath, you are actually causing trauma to the urethra and making the stricture longer. So it's very important for us to know that you should not undergo multiple endoscopic dilatations. It is only for short bulbar stricture which is there for the first time, and never use the catheter inside. If you reach an expert like many of us around who are fellowship trained and who are doing high volume works, we do one of the world's highest number of cases in Eurocool. So we've last year done 610 urethroplasties. So it's a simple surgery. Takes about 1.5 hours. We take a small part of the inner part of the cheek and we patch the area, we make it bigger with a success rate of almost 90%. So it's a simple surgery. Do not get worried that it's an open surgery. There's a very small cut which is sutured by continuous sutures, so you won't even feel where the sutures are. The pain inside the mouth goes away in a couple of days. It's like having an oral ulcer, but one surgery can make you all right. The long-term success of this surgery is about 85%. Occasionally, when there is a trauma or a pelvic fracture, the two ends of the urethra go apart and then you have to bring them together. This involves cutting a small piece of bone which is called as pubectomy. If you go to my YouTube channel and see the surgical videos, if you have the will and wish and courage to it, you will be able to see all the various types of urethroplasties that we perform at our center in Eurocool. So stricture is a disease which has a very easy remedy, which can be managed very easily, or in fact can be cured very easily by undergoing a urethral surgery. And do reach your expert, reach us and we will make you fine. In females, many a times they undergo repeated dilatations because urethra is small. Till now, there used to be saying that there is a chance of incontinence, so no one was doing urethroplasty, but now the concepts have changed. I have invented a urethroplasty called as world's double face BMG urethroplasty in females who have a tight stricture. You can Google about it, and now it's easy for us to do a surgery on a female even if they have stricture. So don't be scared of going to a urologist and undergo repeated dilatation. Stop it. All you need is a single surgery that will make you fine. So if you have any of these symptoms, if you have a stricture, seek help of the expert and come to us. Namaskar, Jai Hind.